Hi guys, welcome back to my channel. So in today's video, I'm going to be talking about a very important topic that affects a lot of women in our society today, generally in the world today. So this topic is about PCOS. So guys, stay tuned as I bring you all the information that you need to know about PCOS. I can't help myself, trying to save my breath in this moment. So what I want to do in this video is to first tell you what PCOS means, the causes of PCOS, the management of PCOS, and the treatments you should get if you have PCOS. So first of all, what is PCOS? PCOS is a polycystic ovary syndrome and is commonly known as an androgen disorder in women of reproductive age. The syndrome is named after the characteristic cyst, which may form or the ovaries, though it is important to note that this is a sign and not the underlying cause of the disorder. So what are the signs and symptoms of PCOS? The signs include menstrual period, irregular ones, heavy period, excess body and facial hair, pelvic pain, difficulty getting pregnant, and patches of thick, darker, velvety skin. This metabolic endocrine or reproductive disorder is not universally defined, but the most common symptoms are irregular or irregular absence period, ovarian cyst, enlarged ovaries, excess androgen, weight gain, hirsutism. Associated conditions include type 2 diabetes, obesity, obstructive sleep apnea, heart disease, mood disorder, and endometrial cancer. This disease is related to the number of follicles per ovaries each month, growing from the average range of 6 to 8 to double, triple or more. It is important to distinguish between PCOS, the syndrome, and a woman with PCO, which is polycystic ovaries. To have PCOS, a woman must have at least two of these three symptoms: PCO anovulation, oligovulation, and hyperandrogenism. This means that a woman can have PCOS, displaying anovulation and hyperandrogenism, without having PCO. At the same time, having polycystic ovaries does not relate necessarily to the presence of PCOS. Also, someone with PCOS can have a very high level of masculine hormones. This is also known as hyperandrogenism. The most common signs are acne and hirsutism, male pattern of hair growth basically, such as the chin or the chest. Also, metabolic syndrome. This appears as a tendency towards central obesity and other symptoms associated with insulin resistance, including low energy levels and food craving. It's also important for you to know that serum insulin resistance, and homocysteine levels are higher in women with PCOS. Polycystic ovaries. Ovaries might get enlarged and comprise follicles surrounding the egg. As a result, ovaries might fail to function regularly. Women with PCOS tend to have central obesity, but studies are conflicting as to whether visceral and subcutaneous abdominal fat is increased, unchanged, or decreased in women with PCOS. Causes of PCOS. PCOS is caused by a combination of genetic and environmental factors. Risk factor includes obesity, a lack of physical exercise, and a family history of someone with the condition. PCOS is a heterogeneous disorder of uncertain cause. There are some evidences that it's a genetic disease. Such evidence include the familial clustering of cases, greater concordance, and there is some evidence that exposure to higher than typical level of androgen and the anti-Mullerian hormone, which is AMH, in utero increases the risk of developing PCOS in later life. The genetic component appears to be inherited in an autosomal dominant fashion with high genetic penetrance but variable expressivity in females. This means that each child has a 50% chance of inheriting the predisposing genetic variant from a parent. And if a daughter receives the variant, the daughter will have the disease to some extent. The genetic variant can be inherited from either the father or the mother and can be passed along to both sons who may be asymptomatic carriers or have symptoms such as hairy baldness or excessive hair, and daughters who will show signs of PCOS. PCOS may be related to or worsened by exposures during the prenatal period, epigenetic factors, environmental impact, especially industrial androgen disruptor such as bisphenol A and certain drugs, and the increasing rate of obesity, along with PCOS appearing to be inherited as a complex genetic trait that is characterized by both androgen excess and ovulatory dysfunction. Polycystic ovary develop when the ovaries are stimulated to produce excess amount of androgen hormones, in particular testosterone. So how do we manage PCOS? Firstly, the primary treatment for PCOS includes your lifestyle changes and use of medication. Goals of treatment may be considered under 4 categories: lowering of insulin resistance levels, restoration of fertility, treatment of hirsutism or acne, restoration of regular menstruation, and prevention of endometrial hyperplasia. So what diet should we go with? Where PCOS is associated with overweight or obesity, successful weight loss is the most effective method of restoring normal ovulations. The goal is to achieve at least 5 to 15% weight loss or more, which improves insulin resistance and all hormonal disorder. However, many women find it very difficult to achieve and sustain significant weight loss. So insulin resistance itself can cause increased food craving and lower energy level, which can make it difficult to lose weight on a regular weight loss diet. And also, the quality of life you live has a major role to play on your weight loss journey. So I'd advise that you watch your lifestyle and eat more of fruits, vegetables, and whole grain food. And also, vitamin D deficiency may play some role in the development of the metabolic syndrome. Medication for PCOS includes oral contraceptives and metformins. The oral contraceptives increase sex hormone binding globulin production, which increases binding of free testosterone. This reduces the symptom of hirsutism caused by high testosterone and regulates return to normal menstrual period. Metformin is a medication commonly used in type 2 diabetes, mellitus to reduce insulin resistance seen in PCOS. In many cases, metformin also supports ovarian functions and return to normal ovulation. Spironolactone can be used for its anti-androgenic effect, and the topical cream eflornithine can be used to reduce facial hair also. I'm going to be displaying the medication I'm currently taking. So we also need to understand that it can be difficult to become pregnant with PCOS because it causes irregular ovulation. Medications to induce fertility when trying to conceive includes the ovulation inducer, clomiphene or pulsatile. Metformin may not be effective in every type of PCOS, and therefore there is some disagreement about whether it should be used as a general first-line therapy. In addition to this, metformin is associated with several unpleasant side effects, including abdominal pain, metallistic taste and in the mouth, diarrhea, and vomiting. The use of the use of statins in the management of underlying metabolic syndrome remains unclear, actually. It can be difficult to become pregnant with PCOS because it may cause irregular ovulation. Also, not every woman with PCOS have difficulty becoming pregnant, but some women with PCOS may have difficulty getting pregnant since their body does not produce the hormones necessary for regular ovulation. PCOS might also increase the risk of miscarriage or premature delivery. However, it is possible to have a normal pregnancy, including medical care and a healthy lifestyle to follow. For those that do an ovulation or infrequent ovulation is a common cause, and PCOS is the main cause of anovulatory infertility. Women with PCOS that are ovulating may be infertile due to other causes such as tubal blockages due to the history of sexually transmitted diseases. For overweight and ovulatory women with PCOS, weight loss and diet adjustments, especially to reduce the intake of some carbohydrates, are associated with resumption of natural ovulation. Now, for these women that after weight loss still are anovulatory, or for anovulatory lean women, the medication letrozole and clomiphene citrate are the principal treatments used to promote ovulation. The anti-diabetes medication metformin was recommended treatment for anovulation, but it appears less effective than letrozole or clomiphene. For women not responsive to letrozole or clomiphene and diet and lifestyle modification, there are options available including assisted reproductive technology procedures such as controlled ovarian hyperstimulation with follicle stimulating hormones FSH injection, followed by IVF. Though surgery is not commonly performed, the polycystic ovaries can be treated with a laparoscopic procedure called ovarian drilling. Puncture of 4 to 10 small follicles with electrocortareal, laser, or biopsy needles, which often result in either resumption of spontaneous ovulation or ovulation after adjuvant treatment with clomiphene or FSH. PCOS can affect your mental health. Although women with PCOS are far more likely to have depression than women without, the evidence for antidepressant use in women with PCOS remain inconclusive. However, the pathopsychology of depression and mental stress during PCOS is linked to various changes, including the psychological changes such as high activity of pro-inflammatory markers and immune system during stress. PCOS is associated with other mental health related conditions beside depression such as anxiety, bipolar disorder, and obsessive compulsive disorder, OCD. Now, if fertility is not the primary aim, if fertility is not your primary aim, then menstruation can usually be regulated with a contraceptive pill. The purpose of regulating menstruation, in essence, is for the woman's convenience and perhaps a sense of well-being. There's no medical requirement for regular periods as long as they occur sufficiently often. If a regular menstrual cycle is not desired, then therapy for an irregular cycle is not necessarily required. If menstruation occurs less often or not at all, some form of progestogen replacement is recommended. An alternative is oral progestogen taken at interval every 3 months to induce unpredictable menstrual bleeding. So it's important to know that PCOS has no cure and it can only be managed. And I am presently managing mine by taking my regular medication. You can also manage yours by taking your medications regularly, and I hope we get through this together stronger and even better. Thank you so much, guys, for watching today's video. See you on my next video. Until next time, bye.